Hello everyone, welcome to my channel. My name is Evelyn. If you're seeing me for the first time, today's video is about NHS supporting documents. I apologize, I've been away for a while. That is because I had something to take care of that did not really allow me to film. So glory to God, I'm back. Like I said earlier, today's video is about NHS supporting documents. So if you've been applying for NHS jobs, you would be familiar with what I'm saying. You may have been asked, why are you suitable for this job? Or why do you think you're suitable for this job? Or they would have asked you, why do you want to work for the NHS? Or is there any other information that would help us to shortlist you? So for NHS Scotland, which is like NHS that I had applied in the past, I know that these are the questions, like the preliminary questions is like pre-interview kind of thing. Is it pre-interview? Pre-assessment questions that you would have to answer that would help them to determine if you're the perfect candidate for the role or not. So most information that you supply on the website are okay. But what really determines if you will be taken shortlisted or not is going to be these three questions. And so many people struggle with it. Either they put very basic things or they just put a description that doesn't really fit what the position requires. So that is why I'm making this video, to educate you. There are people that actually charge money for this, but honestly, I feel like it's nothing. I like to start immediately by showing us an example from a listing on NHS Scotland website. Okay, there are a lot of people that have actually struggled with this. Like I said earlier, either you just say I'm suitable for this job because I have experience, or because I've worked in so it's not enough. And I'll show you what I mean. So if you come to this job listing, I would put the screen recording on either side of the screen. I don't know, so you see what I'm doing. So when you come to this job listing of healthcare support worker, you can see from here that they are looking for, so it is an acute unit. So first of all, you have to check which unit are you going into. Is it an acute? Is it general? Is it just look into the your job description as well, so that you will know exactly what you're going to be doing. So this is an acute unit, and there is general as well, medicine, and there is also frailty unit, all acute. And they're recruiting both band 2 and band 3. And they give a brief description of what they expect from you here, and then the informal contact. Then they also say that band 2 does not meet home office guidelines for sponsorship. I mentioned it before here that band 2 does not meet the criteria for sponsorship. So if you go down, for most of the jobs, to be honest, they would always put this person specification at the bottom, depending on which NHS trust you're applying for. I'm talking about NHS Scotland. You always see these supporting documents at the bottom, talking about person specification, the agenda for change, terms and condition, which is like your pay, and then your job description, both band 2 and band 3. Some roles don't have this. In that case, what I would advise you to do is to read through the listing and see the kind of person they are asking for, or read through the job description. I'm going to use band 3 as an example. So now, talking about one of the questions that says, why are you suitable for this role? You would use this person specification to answer that question. It is very important, because if you are too general without hitting the nail on the head on what they want to see, if you like, write the whole grammar in this whole wide world, or be the best in whichever course you studied, they won't take you. So for why are you suitable for this role, you will see experience. So I'm using, like I said, band 3. They want you to have previous healthcare support worker experience at a required band 3 level. And the method of evaluation is application form. So how do you do this? Why are you suitable for this role? You will start by saying you have a previous experience. I'm not actually here to write it grammatically for you. I'm just telling you the points that you have to include, so you make it to flow. Okay, so you have to write that you have experience. How many months or how many years experience have you had? In which unit did you work? Is it at a band 3 level or a band 2 level? Which hospital? What were you doing? That will show them that you actually worked in a band 3 role. And then there's another one, they say qualifications. It is desirable. It's not essential, but it's desirable. I will always advise that whether it's desirable or essential, try to meet all the essential, because if you don't meet one essential, you might not be taken, except they didn't see anybody and they need somebody urgently. So meet all the essential criteria. The desirable ones, they are negligible, but at the same time, if you can meet the desirable criteria, then you stand a chance. So because here they say skills in vein puncture, cannulation, ECG recording. Pardon me if I don't get it right. So for this role now, even though they say it's desirable, it's an acute unit, meaning that they will do a lot of cannulation, they will do a lot of blood collecting, they will do a lot of ECGs. If you've had this experience, you stand a greater chance than somebody that has not. And even if the person has met all the essential criteria, because they don't have to train you all over again. Although in some health boards, they will still want to train you according to their own standard operating procedures. Yeah. But if you have the skill already, it's just to say, okay, here in this health board, we use the butterfly needle, or we use is it the safety one? There's a safety needle as well. They just show you like the types of cannulas they have, the types of needles they use. Is it the one that resheets itself? Different health boards use different needles or different kinds of things. It's the same thing, but in different way. So if you have this thing already, they are not teaching you, okay, you have to wipe the skin, because everybody knows that for vein puncture, you have to, or even cannulation, you wipe the skin in a certain way. How many times, how many seconds you have to allow the thing to dry, just all of that. So they want to see it in the application form. Tell them how you've been trained, or where you've been trained, how long you've practiced this skill. Okay, how long have you practiced? How proficient are you? So if you have the certificate, explain it there that you have the certificate of training. Okay, and where you're working, how often were you doing it? So put all of those things down. Just write it in a way that is good. Another essential criteria here, you can see excellent written and verbal communication skills, effective team working skills, good IT skills. So all of these skills, they have said it here again. Method of evaluation is application form and interview. Ability to work under pressure, independent. So honestly, if you know this thing, I think it's going to be easier for you to land an NHS job. Whichever role you're working, I'm using band 3 as an instance. But whether you're a nurse or whatever clinical role you're applying for, or non-clinical role you're applying for, as long as it is NHS, if you have this person specification, honestly, it's a cheat code. Because imagine you writing 500-word a document of why are you suitable for this role, and there's excellent skill, all these skills are mentioned, all these things are mentioned. Honestly, you even have more than 500 words. So write all of, include them in a way that flows, by using the STAR method, how you applied them. Don't just say, I have it. How did you apply it in your previous role? If you've not had a band 3 level experience before, or you've not worked in a hospital before, how did you apply these skills that they need? Let me assume that they don't require you to have ECG, cannulation, venipuncture skills. They just want basic communication skills and all of these things that I'm listed here. How were you applying these skills in your previous role, whether you were in sales or you were wherever? Do you understand? Even if you were not actually you've not worked before, how have you applied these skills in real life? So always use the STAR method. I've talked about it here a lot of times. The situation in which you came in to help, the task, what you did, the action, and which result did you get. So if you use that and incorporate all of these things inside that, why are you suitable for this role? I'm telling you, except you had other people that are like stronger competition, honestly, you will be taken. And I'll give you another cheat code in the end. I've mentioned it before, but possibly maybe you never watched the video to the end, so I'll mention it again. So they want to see this in application form and interview. Now this also gives you a cheat code for interview, because imagine you actually preparing for your interview based on all of this. So your personal qualities will be checked in interview, and other ability to travel between sets and they will be checked in interview. I've given past questions on this channel before, but that was on mental health. Even if you're preparing for interview, you've gathered all these questions from different people and different sites, people that were asked. Come to the job and read the job description, and also read this person's specification, because they've told you what they are going to be assessing you on the interview. Do a mental preparation of the questions, assume questions in your head and prepare. That is if you've been called for interview. So that is how to write, why are you suitable for this role? Now, the second question is usually, why do you want to work for the NHS? In that, sorry, let me go back. Another place you can find some materials to use for your supporting statement, like why are you suitable for this role, is in the job description. Go through it. You will see things that are similar to what you've done. And even if you mention some of these things that are here, that you've done them, they will see that, okay, this person actually fits into the role. NHS jobs are more difficult to get now. So this knowledge is very important. I never had this in the past. I was just doing anyhow. I'll just go and look at these people need healthcare support worker in this department. I just go and start applying and mentioning all the skills and all the things I've done, and that does not even align with what the department wants. That's a big mistake. Yes, you may have acquired so many huge skills, but does it align with what they want? No. It's good for another place, but it's not good for them. So if you really mean to get a role in that unit, you have to mention your skills to align with what they want. So go through the job description as well as the person specification to write why you're suitable for the role. Now, they'll also ask you, why do you want to work for the NHS? And they say, consider the board values. Some people don't read that. They're just going to start writing, I want to work for the NHS because the NHS is a very good place to work, because the NHS, they treat their staff well, because the NHS pays well, because the NHS, you will write everything that the NHS is about except the values. NHS has 6 values. These 6 values sums up what the NHS stands for: dignity and respect, working together for patients, commitment to quality care, compassion, improving lives, and everyone counts. You see those 6. If you do not incorporate any or all of it into why do you want to work for the NHS, it's another 500 worded document as well. It's like that one and why do you think you're suitable for this role are all 500 words to show you that they are serious. You have to be able to align your goals with the NHS value. You have to be able to align why you're motivated for the role with the NHS values. All right. Working together for patients. You can say, okay, it resonates with you because in your previous role you did so and so. Dignity and respect. NHS, even in interview, when you're talking anything, just be mentioning dignity and respect. It's like one of the core values. Dignity and respect. Why can't I call respect? Respect. Right. So incorporate all of this and say it to how it resonates with you. Okay. Spell it out. Improving lives. How can you demonstrate this value? How can you demonstrate that everyone counts? If you relate it to a previous experience or a previous encounter or something that has happened in the past, you stand a better chance, to be honest. So incorporate these 6 values. Don't just write it because you love the NHS or you love their colors. No, it's not going to help. So I know that most of you may have already seen this, but I'm doing this also for people that maybe they are just coming in and you don't really know how to go about these things. So incorporate the core values into why you want to work for the NHS. And then there used to be a third question that says, is there any other information that will help us to shortlist your application? Now, remember that why you want to work for the NHS and why do you think you're suitable for this role, which includes also your motivation for the role, is 500 words. That is the maximum. So if there are things you did not add, for this one is usually 250 words. So if there are things you did not add, like some very good relevant trainings, sorry, some very relevant trainings that you've done in the past that you did not have the space to incorporate in the previous write-up, include it here. Do not leave that space blank, no matter what. It is optional. I think so. I think it's optional. Yeah, I'll check. I'm not sure, but you'll see it on the screen. Don't leave it blank, because there should be something that maybe even if you purposely leave it out in the other documents, you put it there. I will not advise or recommend that you leave that space blank. Write all the trainings you've done, relevant or not relevant, in that one, because it's optional. You put the main things up there, but always relate it back to the role, how it's going to help. I don't know if I'm making any sense. Okay, so don't leave that place blank. And say something like you have plans for the next 30 days, which includes what do you want to do, meeting with your manager, learning about the policies. I want to be able to meet with other people, get to know the patients, get to know this, integrate myself, make sure that I'm efficient in this, because they have a settling in period in the NHS. That settling in period is not like you're going to just sit down and be watching all this. Some places, some very specialized places, you sit and watch, right? While some places you will have to be working alongside and be learning those first few months. But just say something there if I'm making any sense. So somebody mentioned somewhere that it is better to apply for roles that are about to close, right? So say a job is closing on the 27th, or maybe a job has just been listed today. You should probably apply for it when it's about to close. In that way, you are quickly called for interview, or your interview time is nearer. I don't know. Well, it might make sense to the person, but I would not give you that advice. In my own understanding, I would say if a job pops up today, apply today, you'll be among the very first people that they will assess. Honestly, it has worked for some people that I know, and some people that I know have helped. Okay, so be the first to apply. My assumption is always that the first people, imagine like they need one person for the role. Let's use that scenario. They need one person for the role and they have 1,000 applications. If you are the manager or you're the person in charge of that application assessment, what will you do? Are you going to go through 1,000 applications just to get one person? To be very honest with you, the first 100 will give you your candidate. So if you now want to leave it to apply to be the 800 person, it is possible, but I won't take that risk if I were you. But that does not mean that if you see a job that's about to close, you should not apply. There may not have been enough responses, okay? The responses to that role may have been very minimal, so you still stand a chance. Please always apply. But what I'm saying is, if you see a role today that was posted, do not wait for it to be about to close because you're waiting for for them to give you feedback quicker. Apply for it that day. If you are not shortlisted, how will you get the interview? So yeah, for me, it doesn't make sense to say I want to wait until the job is 3 days to close before I will now apply, because I want to get feedback quicker. What if the job closes before that day? To be honest, most NHS jobs, they always tell you that apply as soon as you see it, because they may close early if they get the required number of applications. So don't take that risk. I'm begging in the name of God. That's it for NHS supporting documents. I'm hoping that I have not missed out anything. I just gave you like key points. I know some people use AI a lot to write. If you're using AI to write your supporting documents, maybe to make it flow better or for grammatical anything, let it be a reflection of who you are. Let it be your experience, not what AI generates for you. Let it be your experience, okay? Because eventually, if it's not your experience, it will show either in the interview or at some point. They have a way of always assessing what you have written. Some questions can even come from what those things you write. They just look at it and say, okay, let's ask this person this. And if you don't know anything, they will now know that, okay, you probably faked it or something. So I wish you all the best and good luck in your applications. Bye for now.